when we need to hold our breath. If you jump in a lake, if you go swimming, the epiglottis folding down is what really stops you from inhaling water. Now, it's not just that you stop taking action to breathe, it's not just that you close your mouth. Yes, you can close your mouth when you jump in water to avoid getting water in your mouth, but you can't seal your nasal passages. You don't have a mechanism to seal that orifice. What really stops you from inhaling water, if you fall in the water, if you go swimming, is folding the epiglottis down and keeping it down while you are submerged. The epiglottis also allows us to perform what's called the Valsalva maneuver. When we lower the epiglottis, whatever air is in the thoracic cavity down in the respiratory tract gets trapped there. If you need to increase the pressure inside your ventral body cavity, say to go to the bathroom, to pass feces, or to give birth to a baby, taking in a big breath so your lungs inflate so that your diaphragm moves down to inflate your lungs, that's going to push your liver and other internal organs downward. Then by trapping that air inside with the Valsalva maneuver, by holding your breath, you're increasing the pressure inside the abdominal pelvic cavity. And that's going to apply pressure downward onto the bladder, onto the rectum, onto the uterus for childbirth. It's no accident that mothers-to-be are taught breathing routines or how to go through labor. It ensures that they take in a breath and hold it during labor contraction, using the pressure of air inside the thoracic cavity to push the diaphragm down, push a little more downward on the uterus to help encourage childbirth. So, several uses for that epiglottis beyond anti-choking defense, which you probably heard about in ANP1. Make sense? Now, further down in the larynx, of course, we have our vocal folds, the structures responsible for producing vocalizations, sounds, speech, singing, humming. Your vocal folds play a part in that. The vocal folds themselves, they have ligaments embedded in them that can be pulled tight by manipulating the larynx with some of the smallest skeletal muscles in the body. Normally, we keep those folds slack and limp. They're on either side of the glottis. As long as they're held loose, limp, air can move freely through the glottis, the orifice between them, without making them vibrate. That's why normally when we exhale, it doesn't make much of a sound. But if we tighten those folds, if we pull on their ends so they become taut, then, much like stretching out a rubber band and plucking it, or tightening the strings on the guitar and strumming them, the movement of air alongside them as we exhale sends them to vibrate, sets them to vibrate. And that produces audible sound, vibrations, pushing the air molecules into patterned waves that our ears interpret as sound. Now, the vocal folds by themselves, what they actually produce is not speech, it's a buzz. Put your hand on the front of your neck and hum. Do it. Put your hand there and hum. Feel that vibration? That's what your vocal folds can do by themselves. They can hum. They can produce a vibration. Depending on how tightly you tense them, how tightly they're pulled, straight, taut, you can change the pitch. You can hum high or low. By doing that, you can change the pitch of your voice. Now, converting that hum into actual speech, that's a combination of two regions of the body. It's the larynx providing volume in the form of that buzzing hum, and the oral cavity with its various internal structures like your tongue, your cheeks, your palate, working in coordination to take that generic humming sound and convert it into syllables. This is a skill that babies acquire very early in life. When a baby is first starting to make vocalizations, when it first develops enough strength and control of its larynx and lungs to start trying to speak, it'll produce a whole symphony of different sounds. Every kind of possible sound that might appear in a human language, a little baby will produce. But over the early months of life, listening to its parents speak, it will trim back those sounds that are not part of its soon-to-be native language. and get more and more practice producing the sounds that it hears its parents using. Eventually, it'll develop proficiency in producing specific sounds. And it's interesting, it's usually the same sounds that come up first. Ah sounds and O sounds are easier for babies to make than E's or I's, for instance. So they tend to make the ah sound first of all the vowels. Likewise for consonants, M sounds and P sounds and D sounds come earlier than things like S's and T's. It's no accident that so many languages use variations of mama or mama or moody, muma, or things like that for mommy, because those are some of the earliest sounds that babies are able to produce with their vocal folds. Now, early in life, everyone's voice is pretty high-pitched because the vocal folds are short, and short structures vibrating produce higher-pitched sounds. Think about the difference in sound between a violin and a cello, or a piccolo and a bassoon. The smaller instruments produce higher sounds, larger instruments produce deeper sounds. As children age and their larynx increases in size, the vocal pitch shifts to be a little deeper than in an infant. Eventually, at puberty, the voice starts to take on adult characteristics. In women, it only deepens slightly from increasing size as the neck grows larger. In men, at adolescence, testosterone sent to the larynx causes a rapid growth of the larynx, causes it to increase in size faster than the rest of the neck does, which causes the vocal pitch to shift to a deeper octave at puberty. When a young man's voice cracks, it means that he's reached a point where his larynx is too large to produce the high-pitched sounds he's used to producing as a boy. And at first he'll try to speak as he did as a child, keep using high pitches, and his larynx just isn't equipped to produce them anymore. So there'll be points where he just tries to reach for a high note and can't make it. His voice will just go silent. Or he'll try to reach for a high note and then have to shift to a deeper octave in mid-sentence because he can't produce that high sound anymore. It can be tricky for young men to go through this period of voice cracking. Imagine trying to play a violin as it's growing to the size of a cello. Pretty hard to stay in pitch. So only after the larynx ceases its accelerated growth and reaches its adult size will the young man then get to master his deeper sounding voice. Now all this assumes the laryngeal folds, the vocal folds, are able to vibrate properly. If something's interfering with their vibration, say they are swollen from inflammation, then they may not be able to vibrate right. Just like a violin will not produce a proper sound if its strings are soaking wet and unable to vibrate because they're too heavy. During inflammation, remember that tissue becomes swollen with exudate. When that happens in the larynx, these vocal folds can become too waterlogged and heavy to vibrate when sound passes over them, which is why laryngitis, itis for inflammation, when inflammation of this organ happens, it can make you lose your voice, unable to produce the proper buzzing sound to add volume to speech. So a person with inflammation in their larynx, until that inflammation clears up, all they can do is whisper. A whisper is essentially your oral cavity shaping exhaled air into the sound shapes of syllables without that buzzing power produced by the larynx. One more thing before we let out. Remember I said the upper respiratory tract, a lot of it was designed to trap incoming particles? Well, after air is passed through the larynx, we get another chance to do so. The walls of the trachea and the large bronchi that branch off to go to the lungs and the different lobes of the lungs, they're lined with more epithelium covered in mucus. Remember that pseudostratified columnar epithelium that drove you crazy having to write it out in AMP1? It's such a long name. That's what we find on the lining of the trachea and large bronchi. And just like in the nasal conchae, we have here cilia and mucus-producing cells, both goblet cells and deeper glands producing somewhat thicker mucus. Their products are going to act as flypaper to trap incoming particles. To make sure we trap them successfully, we also have a strip of smooth muscle tissue at the back and rings of smooth muscle around the bronchi further down. This allows us to constrict the airway somewhat when the air quality is low. When you go into a dusty attic or a smoky room, it gets harder to breathe. You ever notice that? It's not that the dust is harder to move in and out of your body. You know, if the dust was that heavy, it would be lying on the floor, not scattered through the air. Rather, it's that when there's a lot of particles in the air and they start irritating the lining of the trachea, it sends out chemical signals to the trachealis muscle, this piece of smooth muscle here, that constricts it. Now, normally our airways, our trachea, our bronchi, they're kept open by pieces of cartilage. We don't want them to collapse, so they need to have supporting struts. And normally they're kept wide open for easy flow of air. But if the air quality is poor, strips of muscle like this pull the ends of the cartilage loops inward, narrowing the lumen. That means there's less distance a particle needs to move to hit the mucus walls, to hit the layers of mucus that will trap the incoming particles. It's not that it's hard to pull dust into your lungs, it's easy to do that. It's that your airways narrow to reduce the odds of that dust making it all the way down to the lungs by making it easier for the dust to hit the walls on the way in. Normally it takes quite a lot of dust or other contaminants to trigger this reflex, but in some people it's overly sensitive. In some people the constriction of the airways and also production of extra mucus by the irritated walls of the air passages can be tripped too easily by tiny amounts of dust, by minor irritations like cold air. And in that case, this reflex can go off when it's not needed. We saw how allergies happened when our body's defense mechanisms were triggered without reason, like our inflammation. That was allergies. What do we call it when our defense against inhaled dust is triggered without reason? Triggered too easily. Anybody know what that condition is? Asthma. In people with asthma, the lining of the airways is too sensitive. It too easily trips the reflex that constricts the airways and that increases mucus production from their walls, thus narrowing the lumen to a point where it can become difficult to bring in enough air for survival. So this mechanism, designed to be a defense, can instead itself be a threat in someone with asthma. What can a person who's prone to tripping these reflexes, who is overly sensitive to dust and other irritations in the air, what can they do to prevent asthma attacks or to stop them when they happen? Inhalers. There's two basic kinds of inhalers. There's inhalers designed for maintenance. They tend to have anti-inflammatory chemicals in them, like antihistamines. They help reduce the sensitivity of the lumen wall, so that small amounts of dust are less likely to trigger an attack. There's also rescue inhalers. These are used when an attack is actually happening. And they contain bronchodilators, chemical muscle relaxants, that will cause smooth muscle like this, and further down in the respiratory tract, to relax, to open up the airways, to allow them to breathe normally. Why are they given as inhalers? Because the tissues that we want to target are more easily reached by sending the particles of medication through the airways directly to them than by, say, injecting them into the bloodstream or sending them into the digestive tract. It takes many minutes for a drug to get into